Afternoon, everyone. Today is Monday, May 11th, 2020. The time is 1 p.m. This is a special meeting to continue our fiscal 21 budget considerations. Today we're meeting with our coroner for the fiscal 21 budget review. Attending are Commissioners Duncan and Filios physically, and by phone joining us is Commissioner Bill Brooks. Do we have any changes to the agenda? None? Okay, our one and only business item, potential action. Once again, fiscal 2021 review with our coroner, Dr. Keene. Come on up.
Thanks, Chris. Thank you, Leslie. Thanks, Bill, for being here by phone. Again, we bring forth the coroner's budget from the 2020 May 11th and of the fiscal year 21. We'd like to bring forward the 2% that you gave us in the B budget without really any changes. I'd like to re-emphasize that we have a lot of other professional components to our costs, and hopefully they're not going to go up, but Spokane is on a calendar year budget, and so we won't know any prices for next year until possibly September, October. And so right now we're not anticipating any increased costs at this time. Dina, can we push that forward?
Absolutely.
So as we are in uncertain times with the COVID thing and how much revenues we're going to have, we need to look at our future needs. And as I've talked with previously with Chris, I'd had discussions with Panhandle Health about PPE equipment to be ready for our Panhandle Health District, and they were a little bit short. I have enough PPE for my team, but obviously I don't have enough for everybody else in the county or in the region. And so we're going to look at those kind of things and see if we can't get a little bit of a stockpile, if there's a little slack in the system. Right now everything's on back order, and so we're not doing that. We have increased costs. We're relying on Spokane for doing all of the autopsies. We send off a lot of tox screens to the national lab to keep track of things, and all of those things are going up. We have more first responders asking us to do COVID tests on decedents, but it's nice to know that Kootenai County does not have an epidemic. Kootenai County has a very low rate. There's 66 people in the county as of yesterday, and only 3 are still being monitored. So out of 164,000 people, we're monitoring 3 for COVID. Nobody has been in the ICU at the hospital, and we have not been overwhelmed by anything in the county. And as a result of that, our people are not infected, and we still have the same rate of death as we had before. It is starting to increase. If you look at the numbers that we have supplied to the clerk in the past, in 2015 there were 1,323 cases that we handled. 2016 it was 1,414. 17 was 1,507. 18 was a little bit slower at 1,542. Last year it was 1,649. However, in the 4 months, and these are the numbers as of Friday, we have 562 cases that we've handled, which will put us on a yearly total of 2,248. So that's an increase of 600, which is a lot. But fortunately, most of those are naturals. We don't have too many of the suspicious deaths, and that's why we were able to return a good deal of money to the general fund last year, was because we didn't have a lot of suspicious deaths. But we also need to look at the past and try and predict the future. And in the past, last July, we had that shooting on July 4th, which could very easily have turned into a mass fatality situation. But fortunately, Coeur d'Alene police corralled the individual, and it was well controlled. We have a couple of homicides, usually a year, sometimes 3. Last month, we had 2 homicides in 1 week by 2 different people. The last time we had multiple homicides was the Grony case, and that was 1 person killing a lot of people. So we need to look forward to those kind of things and see what we can predict what's going on. The estimated caseload of 2248 for the year, I think significantly justifies the ask that I have to make my .67 part-time deputy into a full-time equivalent. The work is there. We're going to, fortunately, with the teleworking, we have not been behind. We're keeping even, but those are some of the numbers that we're looking at. These are our cost drivers that we have. You can see the PPE and medical supplies are very small, non-capital equipment. Other professional services is a lot of our toxicology and our pathology and radiology, which is where all the autopsy, special tests, and other things in here are what we're seeing is going to be the most difficult thing to contain. If you project those costs forward, where we are now, and in 2020, by 2025, it could be $450,000 just in that section alone. And that's where we'd like to bring us to our capital costs of the ask for the laboratory that we've had before. Our full-time position is going to cost $20,000 extra because once you get over the 29 hours, you get into loaded costs, and that's where the Percy and healthcare and all that kind of stuff really adds in. Our on-call pay, which allows us to be as soon as possible to a unattended death, is a small cost of the $15,673 that it was last year. I think it's an essential part because without that, we then have to go to a 1 or 2 hour response time and a funeral home 1 hour response time, and that keeps law enforcement on the scene with 2, 3, 4 deputies, and then they go into overtime. And I know at the budget discussion, there was a big thing to keep overtime to minimal because I believe it was 20 employees at $75,000. That's how much all of our overtime together was. And so the minimal $15,000 to cut down on law enforcement overtime, it's not my budget, but it's a part of law enforcement that comes out of the entire pie of the county's money, would be very helpful.
So can you help me understand that a little bit? So you're saying that right now that whoever's on call won't respond unless they're getting on-call pay in a timely manner? Is that what I'm?
Right now, the policy in the office is that they get $250 a week and that they are supposed to put everything else on hold when they're on call. And when they get the phone call for that law enforcement's needs is at a scene for unattended death, that they respond as soon as possible. But if I can't force them to give up their life, then I have to assume that they're going to do things that I don't necessarily agree with. And if they have an adult beverage, it's 2 hours to metabolize one adult beverage. They can't drive a county car with an adult beverage, and so that gives it a 2 hour response time.
Okay. I guess I just never looked at the deputies like that before. I just always have heard great things from Sheriff's Department, everything that they respond quickly and
Absolutely.
and all that,
They
so.
respond within minutes. They put their life on hold, and the $15,000 is a mere trickle to keep them ready and keep everybody happy.
So you're proposing the 15,700 on call versus the flat 250 per week?
No, that's the
No,
same,
it's the same.
same number.
Oh, it's the same number, okay,
Yeah, so it's not changing anything from what we're doing today.
okay.
But during the budget cycle, I was told that we need to re-up this and re-justify that to come into the A budget.
Okay,
And so that's what
okay.
I'm doing, is bringing it forward once more as to why it's necessary to do that. So it really doesn't change the A budget at all. But it is an ask because I was told I needed to ask for it.
Okay, okay. Keep going.
And the last big ask, and you've seen, I don't know if you remember last year's numbers, but the pathology lab in the remodeled work release pod, I think is essential. It's going to get more and more expensive each time we bring it up and it gets turned down. When they were first redoing the jail, the 3,000 square feet would have probably cost $300,000, but the commissioners didn't want to hear about any change orders at that time, and then we've gone through the budgeting cycle every year since then. Last year, I believe it was in the $550,000 range. We're still not into the work pod because of the fire code reasons. We can't go in there until that's completed, and I don't know when that's going to be done. So, doing all of this stuff in-house sounds like it might be long-term expensive, but I think it saves money in the long term by doing it in-house here by doing the pathology remodel. Last year, I was directed to get an out-of-town consultant to see what kind of price tag they were looking at, and I went to the same people that designed the jail out of Boise, and I took a couple hours out of the Coroners Association meeting and went to their architects. And I don't know where their numbers came from, but they came up with $2.1 million to do the same thing that our architects are giving us for $751,000.
But I see you also have a estimate from Lombard at 1.6 million and H2A at 793,000.
Right, the Lombard is 1.2 because there was no way with all of their figures and all the things they were including that I was going to put that in the budget. The 1.6 is just the actual small stuff. They were adding in things like furniture and coolers and all other kinds of things, plus an extra amount of money for architectural supervision. The H2A was with Dale Hickman, who was working there, and he was the first one that gave me an estimate, gosh, a bunch of years ago. But something happened and H2A was no longer on the approved architects list. And so in discussing it with Sean, he said stick with Scott, who we have, and that's where I got that number from. And then Dale has retired from H2A, but I had his information, so I included it for completeness.
Sure. Do you know if any of these bids took into the account of the actual work release center and the fact that there isn't really a provision for a second floor and that it would probably cost more
Yeah.
than the work release is worth?
I don't know about how much the work release building is worth, but yes, that was taken into all the architects where they were talking about putting in footings for a load-bearing wall, extending the second floor across the mezzanine to meet code and be usable for office space, conference rooms, that kind of stuff. And that kind of goes to, you know, building in the county. There's 2 underutilized pods in there that if you put in a load-bearing wall, you could get 8,000 more square feet for a lot of double offices on a corridor. You could put cubicles in there and you'd have a lot of extra room, because I know we were tight on room. I think Sean last said we had 900 square feet that wasn't utilized.
What's currently holding us up on the work release?
There's an agreement between the county and the monitoring company that needs to be filled out. And it's my understanding that they're trying to figure out who exactly is supposed to get that phone call at 2 o'clock in the morning.
And talking to Greg, it's code that in a non-24-hour building in the county that we have to have a remote alarm fire system, and that was not put in during the construction. And in talking with Greg, there are 2 companies that will pull wire and put that remote alarm system in, and that hasn't come up yet at a business meeting where we can move forward.
Well, that's,
And then where is that phone call going to go?
just as an update, the panel itself doesn't need to have anything pulled to it. I think you and I talked about that. It was just the running of a phone line. So it's my understanding right now that once we get the monitoring agreement, then I'll call the fire marshal and he'll come out and verify. So I think that's all we're waiting on. They seem to feel like they have everything in place. And that's correct. If you're not in the building, it was set up originally like the jail where they were in the building 24/7. So if the fire alarm goes off, they're there. That work release was that way when it was built, but now work release is housed in the jail, and so you have to have by code a monitoring system that is off-site monitored for dispatch purposes. And so that's what held it up. I'm hoping to get that. I can only push so hard.
How close are we to resolution?
Pardon?
When do you think we can get this resolved?
Any day now.
Okay, how big is the space?
Well, the office space that we're in is just the second level mezzanine, which is really quite small. It's probably 200 square feet, maybe a little bit more than that. 400 square feet or so? But then
It affects the whole building, that's the problem.
Okay,
and then the bottom layer is still the previous work pod design with showers, bathrooms, and open space.
okay.
But the whole one floor is about 2,000 square feet, and if you double it, you get 4, and if you do the other pods, you'd get 8. But anyway,
Okay, let's go
using that area for a pathology lab, the architects did take into account how much it would cost to put in a second level, as well as the air handling system for the lab, which has to have special filters and those kind of things. So that was, I was clear with those, and they talked about those, and Scott gave us some good numbers, although Scott said when he gave me the numbers that it's really hard to predict costs on a small project like this. And as we know, last year we estimated that the remodel would be in the $45,000 range, and you guys put in $60,000 in the budget, and we were 30% over that in order to get it in. So I don't know, those are just the numbers I've got, and so those are the numbers that I'm bringing forward. Last year, it would have taken us 5 years to pay off the lab. This year, or this time, it would probably take 6 or 7 because of the increased expense.
But that doesn't include operating costs. You're just talking about paying off the hard costs.
Right, that's correct. And operating costs, in my mind, in my theory, is that once the lab is built, we can control how many autopsies we do. Right now, the pathologists in Spokane are doing 200 to 250 a year. We would be doing maybe 40, maybe 60, and we could independently contract with someone if they would want to go to a semi-retired position where they would be doing 1 or 2 days a week instead of 5 days a week all the time.
But again, what's the benefit? What do we lose by not maintaining the relationship we have now with Spokane? I mean, if we're going to invest $750,000
Right.
just to get going, how do we justify it? In other words, we still have a relationship with Spokane. That's not likely to go away. So how do we justify making that level of especially in light of the fact that our revenues are uncertain for this year just because of COVID? But go ahead.
Right. The relationship is getting a little bit strained with the staff. I have a great relationship with the doctors, but the staff is now trying to tell us how to do cases in Idaho. We had an individual who passed and was unidentified, and we wanted to fingerprint that individual. And we were told that if we fingerprinted that individual, the pathologist would refuse to do the autopsy, which by contract, they can't. But that's what we're sitting. They continually give us reports that are incomplete and won't go into the report and say, okay, we added the information you needed, now it's a complete report. The usual response is, well, check back every few days, and when you find it's complete, then it's complete. So those stresses, I don't know if it's because they're working exceedingly hard over there. They are packed most of the time. As I talked during the original, or one of the previous meetings, they are making demands on us. I mean, Spokane has a few COVID cases. We have very few, but we were supposed to provide all our own PPE, and then they wouldn't let anybody come in unless it was an actual homicide, and that it had to go to court. And I don't know, I don't think that's a appropriate way to do things. At some point in time, and I've brought this up before, they are going to let us go. I just can't predict what time it's going to be. We have a 30-day out clause in the contract. I do everything I can to make things smooth and meet all of their demands. But when you have a monopoly, sometimes public service is not on your highest priority.
So what about their new facility? Isn't that opening this month?
I have no idea when it's
Expansion.
opening. I haven't followed it.
Bill, any questions?
No, I don't have any questions.
And so these are the costs that I have looked at to see what ongoing costs would be. And I chose about 50% of what a cost of a full-time pathologist is. The last time the Ada County coroner collected a new pathologist, they're paying in the $225,000 to $250,000 a year salary, and then there's loaded on top of that, and then there's some educational requirements. If we had an independent contractor who is, semi-retired, but still wants to keep their hand in, I think we can do those kind of numbers quite easily. If we take 1 day of deputy time and cross-train them to assist, that comes out to be $8,000 a year. Consumables include caps, gowns, masks, cleaning supplies, all those kind of things. The refrigeration of the coolers is kind of straightforward. And then if we do any marketing for new services to other outlying communities, to private autopsies, those kind of things, that's what my projection of what the annual cost would be, the $112,248. Some of the revenues that we may be able to get, I've been approached by ISP from some of their detectives because the federal prosecutor feels he can get drug trafficking charges if some of our people who overdose. Then we'll let them know who the dealer was. And for us to do, we currently would do a tox screen on that individual if there was nothing else suspicious. And if we do a full autopsy, those would be the charges to the federal prosecutor to get for doing more than we really need to do. If we do tissue harvest for the companies that market those kind of things, just an access would be the $8,000, and if we contract for other types of autopsies privately, we would have those kind of revenues. The big thing is the witness fees. Many of the prosecutors want that autopsy and want that kind of stuff because then it locks in an expert witness for them. And
For the 3 cases a year?
Pardon
For
me?
the 3 cases a year?
Well, that would be for the 3 homicides, correct? But we have way more than that of overdoses. And that's why I estimated at the 3 homicides a year and the 9 overdoses, the expert witness fees, and that's where that $400 an hour at $38,000 comes from. Because if you had somebody on contract, you could probably negotiate those considerably less.
Right, but if the 9 drug overdoses are requiring expert witnesses, then wouldn't that be a homicide case?
They would try it as a homicide, but it's not listed in my book as a homicide because homicide in the coroner's case is that death at the hands of another. In the federal prosecuting land, it has to do with behavior that is callous and ends up being a death. Most of our overdoses are accidental, but that doesn't mean that under federal law, they can't go after the trafficker for being responsible.
Okay, so bottom line, you were thinking, if I heard you correctly, how many autopsies per year early on are you forecasting? If we
Well,
were to do
it
this?
averages. I mean,
About?
my predecessor had 80 in her first year. Last year, I think we were at 42, and before that, we were in the 50 range. So if I average that out at a 50, that's about 1 a week, and that's where I came.
And what would we charge?
Well, we wouldn't charge, we would have our own,
No, we'd have our own, but you're assuming those 50 are our own?
right.
Okay.
Well, I don't have any control over anybody. I only have people in my county that I have control over. Those are then the unattended deaths that the court
Okay,
has
so for
jurisdiction.
this, so then for the, I'm trying to, okay, let me rephrase it. So if we have 50 per year, and I'm just going to concentrate for a moment on the pathologist
Okay.
at $100,000. So essentially, if I average it out, it's $2,000 per autopsy.
That would be average. We currently pay $3,000.
Okay? And is that the going rate?
Yes.
Okay.
Now, if you're doing a private autopsy, that's completely different. Private is the next of kin in the family. Talk with a private pathologist and they can get an autopsy done. And that's usually in the $5,000 to $6,000 range.
Okay. Now, if you market your services to, let's say, neighboring counties, How much would you anticipate charging?
I think that's, in marketing and business, you always want to be less than the person you're in competition with. And so if it's 3,000 across the region, you'd probably want to be in the 2,500 range.
Okay.
But that could force Spokane into a price war as well, and they have a lot more,
Clout, so to
well,
speak.
not necessarily clout, but volume and.
Volume,
the
yes,
ability
yeah,
to do,
that's what I meant, yeah.
to keep that up, so.
Okay, so your A budget is adjusted by, was it going the part to full-time?
Yes.
Okay. All right. Your B budget, okay, you're staying within the guidelines. Now, you're showing the A budget going up by approximately 10,000, but I thought that the differential was more like 20. Or is that loaded? Is that what we're talking about? What's the difference, Dina?
I think that I did this earlier on.
Oh,
but
okay.
Basically, I'm showing it for purposes of a trend. So if you look out towards the future after this one-time cost happens, you would estimate what your ongoing operating costs would be given a lab, then you would apply revenues that you could possibly get for that. And it would show that over time, it would be about an 8.6% increase net to the coroner's budget.
Which, and if we're looking at the Part B expenses, if you remember that previous slide, over a period of time, we were going to be going up to $450,000 in the B budget by itself.
Assuming that we could get the work that we're anticipating, and assuming that, you know, pathologists don't all of a sudden become rare, and now they're really
They're
expensive.
rare now.
They're rare now, yeah.
There are, and I talked to John Howard when we had a conference down here last September. John Howard came over and presented to the law enforcement and to the regional coroners on injuries in children. It's one of his areas that he likes to talk about and educate people. And he said that there were, I believe, 100 openings for forensic pathologists, and they only graduate like 29
Annually.
annually. And so that was why when I talk about an independent contractor position for somebody who wants to get out of the, you know, Cook County grind of that many deaths all the time, that they would, you know, we have a beautiful place to live, and they could come out here and live and do really pretty well on a, you know, 1 a week or 2 a week position.
Any more thoughts? Bill?
No, I'm fine.
And if I could, I'd just like to introduce my team. They get
Sure.
kind of unsung heroes that they are. Do you have some pictures, Dina?
Oh, I pulled
You
those
wiped
out
them?
because we didn't
Okay.
have some.
Lynn Acevedo is my chief resident, chief deputy, who is Miss Compassion in the office. And she goes the extra mile to meet all of the next of kin, answer their phone calls as best she can, meets with law enforcement. She's very passionate about her job. She has a forensic criminal justice degree, as do all of my people have degrees. She makes sure that Suicide Prevention Area Network gets current data. She's there at all of their meetings. She goes to the lethal means meetings and discusses with all the people different kinds of things we can do to lower the suicide rate. She goes and sets up the tables at the Walk for Life for the suicide group, and she goes to all the gun shows to talk to gun owners about gun lock safety.
Okay.
John Hunt has been in Idaho for a long, long time, Sandpoint raised. He has a tremendous work ethic. He's a firefighter, he's a paramedic. He was assistant fire chief at Northern Lakes. We coerced him out of retirement to come in and be our education supervisor, which he loves teaching everybody. He teaches law enforcement, he teaches the paramedics, he teaches the fire response people, he teaches them all the different kinds of things that are important to the coroner's office so that they don't change evidence at the scene. He loves to teach photography, rappelling, and safety and PPE for all of us. He's a very valuable member, but
Okay.
I can't go against Percy and strangle him into more hours. I can only get that 2.5 out of him. Joanne Porter is our latest member to become board certified by the American Board of Medical Legal Death Investigators. We have a national standard. You have to work hundreds of hours in the office to be qualified to take the test. You have to be signed off by another certified deputy on all of the tasks, which have to do with cultural issues, wounds, whether they're gunshots, knives, natural illnesses, forensic evidence, fingerprinting, and she passed that last year. She's our computer guru in the office.
Congratulations.
She makes sure that everything is completed and done. She hates to go home if there's paperwork on her desk, but sometimes she gets forced to. And so this is my team. They make me I want to extend congratulations to all of them because this is the first time in the history of the county that everybody in my office is board certified for national standard.
Cool. Congratulations, everyone. Okay.
You also wanted a truck?
A trickle-down truck, I thought that's
Yeah.
what fleet management was. We are now asked to bring more things to the scene, and it's more remote than it has been in previously.
So what kind of things?
Lights, ladders, screens, backboards, all those kinds of things that won't fit. We have a Ford Escape now, it won't fit in there.
Would you ever foresee this truck being used to transport a body?
It could double as that if the fortunes were not in our favor, yes.
Okay. Okay. And that's in the capital ask?
No, I was told it just has to be
Oh,
noted
Through
through fleet management.
fleet management, okay. It's in, oh, it's existing, okay, fair enough.
Sorry, that's what I meant by trickle down.
Okay, yep. Okay, anything else?
I won't be able to support the lab again this year. I mean, I understand about the trends, I understand about the money and all that stuff, but we're just kind of in a whole new situation here. And with our new growth numbers going down, I'm really set on trying to do a 0% tax increase for the citizens this year because we have such a high percentage out of work right now. So I appreciate you bringing it forward as always. It's good to have in the forefront of our mind to know what's going on. But with Spokane increasing, you know, their capacity, I just don't see how it's going to work out in our favor right now.
Bill, thoughts?
Well, I tend to agree with Leslie. This is a really unprecedented year. And this, unfortunately, all things come together to have, in my opinion, this should be pushed off again for another year. And I don't like doing that, but I think we'd be remiss if we went ahead with it.
Yeah, and as I indicated earlier, because of the COVID situation, the whole revenue thing is up in the air.
Well, as an alternative, and I sent out the email in March about this COVID funding and what kind of problems we're going to have. But also with Sandy and Tiffany and the OEM, they're putting up the new all hazards mitigation plan, which if we are in that plan, it gives us a better opportunity to move forward. And what I mean was before, FEMA would never allow new construction in the mitigation plan. They would do, you know,
Right.
tunnels and culverts and
Right,
bridges
right.
and that kind of stuff, but not a building or remodel a lab. In the new law, according to the consultant, there is a post-mitigation area where funding is now available for new construction, but it has to be shelf-ready. And as the alternative, if the cost of the lab is the $751,000, if we can take the design part of that, which is 7 to 10%, and do the actual design so the architect has it all done out so that it's on the shelf in any event of a mass fatality hazard, we can then go to the post-mitigation portion of the FEMA and be able to take that plan off the shelf and then build it and remodel it in the space that we have. But it does mean 7% of that would be, what, $49,000?
Yeah, yeah.
I think we're still too tight this year even to do that. And my biggest issue is the ongoing costs. Just having that.
Yeah, they're recurring.
Yeah, and not knowing, exactly what the revenue would be and just kind of a guess how much the ongoing cost. So that's why I can't get there this year. I do see the need to bring up a second full-time employee. So I definitely want to consider that part of it. But yeah, as far as the lab goes, I just don't even see, we're still like $7 million over the number we need to get to, so.
Yeah, I'm sympathetic to the going from part to full-time. I have no issue with that. But as far as the lab is concerned, I think it's still, and I think Leslie said it well. I mean, we've got a $7 million shortfall, certainly far better than last year at this time. But at the same time, it's not just the initial investment, it's the ongoing cost. And I don't know that we're at a point, especially given the COVID situation, where we can even consider that at this time. So, again, I'm sympathetic to the part to full-time, but not the lab at this time.
Or the design.
I'm sorry, no,
Right.
or the design,
Right.
yeah.
Question though, so you mentioned PPE and everything, so you guys already do glove up and have a certain amount of protection gear when you deal with any deceased, is that correct?
Yes.
Is it possible that one of your members can get COVID from a deceased person?
Theoretically, yeah, but actually probably not, because we use PPE. We use the
Right.
same PPE that first
Yeah, but they're
responders
not
use.
coughing or sneezing or, transmitting it, I'm sorry, that's just where my mind goes. So they're not able to expel any.
If you move the body, there are body fluids that come out,
Okay.
and they can come out of the
Yeah,
respiratory
yeah.
system as well as digestive system and other places.
Gotcha.
Have you looked into the possibility of grant for design?
Well,
Is-
as you remember in, is that January? It was last fall. It was last fall, sorry. We talked about writing a grant for mitigation and those kind of things, and at that point in time, I talked with Grants Management Office
Yes.
and with OEM, and there was no way to get the data necessary for me to write a grant at that point in time. I watched the grant cycle from the Coroners Association and the, Justice Department for any type of thing where we can talk about building. And the only place where building comes into is in the all hazards mitigation plan post-event. Other than that, they won't let you build anything. But one other issue I'd like to at least bring up for thought is that we're not in the building yet, and the 48-inch doors were cut out of
That's
the
correct, yeah.
original design. Where the back door is now, since it's a stick building, could a 48-inch door be put in? And then that would alleviate the storage concerns that somebody has about where the coolers are currently.
But I was there, and it doesn't seem like the hallway would allow for it. And would you have to do more than just the door? You'd have to readjust the hallway. It's a pretty narrow.
Well, I haven't measured the hallways because I was gonna go for the whole lab, but I could measure them and get back to
Well,
you.
and the doors are what, 8,000 apiece, is that
No,
correct?
we were-
4,000 apiece.
I'm sorry?
It was just short of $8,000.
Oh, for the two.
that we took out, but you have to keep in mind, that may not be the price the next time you ask.
Okay.
Because they were
Right.
part of an overall bid. So a smaller thing like that is harder to predict if it's gonna be 6 or 10.
Right, and a 48-inch door at Home Depot is $1,200.
Plus installation.
Well, plus install, plus you have to keep
Right,
in mind
right.
that these are they're both fire exits, so they're gonna have to be done however the fire marshal wants. them done.
Right.
Is they don't care how people get in, they just care how quick people
Well,
get in.
and the thing is, we do have the storage capacity at the airport, at the Armory.
Yeah.
So we can accommodate them there. Now, if we put the armory to alternative use, and there's a proposal coming forth, I think, this week to do that, and it presents a problem for storage of the body coolers, then we might have to be able to take up the question of the 48-inch doors. But I don't know that that's going to be an issue. Yeah,
Thank you for your time.
okay,
Thank you.
thanks. Public comment? Hearing none. 1:40, meeting adjourned. Thanks.